One single molecule of catalase can break down 40 million molecules of hydrogen peroxide every second. That kind of catalytic power is exactly what makes enzyme kinetics one of the highest yield topics in your entire biochemistry course. Without a catalyst, breaking a single peptide bond in water at neutral pH could take literally hundreds of years. Enzymes take that same reaction down to milliseconds, without being consumed, and without changing where the reaction ends up at equilibrium. Formal definition, professor style. An enzyme is a biological catalyst, almost always a protein, that lowers the activation energy of a specific reaction without being permanently altered or consumed in the process. Here's the concept your exam loves to test. Enzymes reduce the free energy of activation, delta G double dagger, the energy hill between substrate and product. They do not change delta G of the overall reaction, and they do not change the equilibrium constant. They simply get you to that same equilibrium far faster. Here's why this matters at the bedside. After a myocardial infarction, cardiac troponin begins rising in as little as 3 to 4 hours. We'll come back to exactly why that number matters later in this video. 3 terms you need locked down cold. The active site is the enzyme's three-dimensional pocket where catalysis happens. The substrate is the molecule that binds there. And the enzyme-substrate complex, the ES complex, is the transient intermediate formed the instant substrate binds, before it's converted to product. Myth: enzymes get used up as they work, like fuel in a tank. Fact: an enzyme molecule is chemically identical at the end of the reaction as it was at the start. It's released unchanged, ready to catalyze the exact same reaction again, millions of times over. For defining properties, every enzyme shares enormous catalytic power, accelerating reactions by factors of 1,000,000 or more, exquisite specificity for a particular substrate or reaction type, tight regulation by the cell, and the fact that they are never consumed in the reaction they catalyze. Everything from here forward builds on these 4 properties, especially catalytic power and specificity, which is exactly what the Michaelis-Menten equation was built to quantify. 2 competing models explain how an active site recognizes its substrate. The older lock and key model, proposed by Emil Fischer in 1894, pictures a rigid active site shaped exactly like its substrate. The modern induced-fit model, proposed by Daniel Koshland in 1958, describes the active site as flexible, reshaping itself around the substrate as it binds. Zoom into a serine protease active site, and you'll find the classic catalytic triad: serine, histidine, and aspartate, positioned precisely so histidine pulls a proton off serine, turning it into a powerful nucleophile that attacks the substrate's peptide bond. On your exam, you'll be asked to distinguish these 2 models directly. Lock and key explains simple, rigid specificity. Induced fit explains why some enzymes can still catalyze reactions on slightly different substrates, and why binding itself can trigger conformational changes that align catalytic residues. A cofactor is any non-protein helper an enzyme needs for activity. It can be an inorganic metal ion like zinc or magnesium, or an organic molecule called a coenzyme. An enzyme missing its cofactor is an inactive apoenzyme. Add the cofactor back, and you get a fully active holoenzyme. Most water-soluble vitamins exist specifically to become coenzymes. Thiamine, B1, becomes TPP. Riboflavin, B2, becomes FAD. Niacin, B3, becomes NAD+. And pyridoxine, B6, becomes PLP, each one plugging into a completely different family of enzymes. Cofactor is the umbrella term. Metal ions and coenzymes are both subtypes. The distinction that matters for your exam is that coenzymes are organic and usually vitamin-derived, while metal ion cofactors are inorganic. Exam Pearl: thiamine deficiency cripples pyruvate dehydrogenase and alpha-ketoglutarate dehydrogenase, both TPP-dependent. That's the direct biochemical link between alcoholism, malnutrition, and VRNI-key encephalopathy, beriberi, and lactic acidosis. Enzymes are exquisitely sensitive to their environment. Pepsin, working in the stomach, has a pH optimum around 1.5 to 2. Trypsin, working in the alkaline small intestine, prefers a pH around 8. Same catalytic logic, completely different optimal environment. Plot activity against pH or temperature for almost any enzyme, and you get a bell-shaped curve. move too far from the optimum in either direction, and hydrogen bonds and ionic interactions holding the tertiary structure together start to break down, eventually leading to denaturation. Now that you know how enzymes bind and what they need to function, it's time for the math that actually quantifies how fast they work. This is the single equation you must be able to write from memory. V equals Vmax times substrate concentration divided by Km plus substrate concentration. Derived by Leonor Michaelis and Maud Menten in 1913, it remains the foundation of essentially all enzyme kinetics. Plot velocity against substrate concentration, and you get a rectangular hyperbola. At low substrate, velocity rises almost linearly with concentration. As substrate climbs, the curve bends and flattens, approaching but never quite reaching Vmax, as every active site becomes occupied. Km is the substrate concentration at which velocity equals exactly half of Vmax. Here's your exam pearl. Km is inversely related to affinity. A low Km means the enzyme reaches half maximal velocity at very little substrate, meaning it binds substrate tightly. Here's how it all connects. Substrate and enzyme combine to form the ES complex. That complex can either fall back apart or move forward to product. Km captures the balance of those competing paths, while Vmax reflects how fast the ES complex converts to product once every active site is full. Where does a given clinical or lab substrate concentration actually sit relative to Km? Below Km, the reaction behaves as first order. Velocity rises with substrate. At or above Km, the enzyme approaches saturation, and the reaction becomes essentially zero order. Keep the Km or Vmax distinction sharp in your head. It's about to become the key to unlocking every inhibition question on your exam. Below Km, doubling substrate roughly doubles velocity. First order kinetics. Well above Km, doubling substrate barely changes velocity at all because the enzyme is already saturated. Zero order kinetics. This exact transition is what produces the curve's characteristic bend. If this feels familiar from pharmacology, it should. Km plays exactly the same conceptual role as EC. 50 on a drug dose response curve, the concentration that gets you halfway to the maximum effect. High-yield clinical application. Phenytoin and ethanol are both metabolized by enzymes that are already saturated at typical therapeutic or physiologic concentrations. That means both follow zero-order kinetics. A constant amount is cleared per unit time, not a constant percentage, making phenytoin dosing notoriously easy to push into toxicity. Lock it in. Km is concentration. Low Km means close binding. The K stands for concentration, and a low Km means the enzyme grips its substrate tightly, reaching half speed without needing much of it around at all. Km and Vmax are the two numbers every kinetics question hinges on. Next, how you actually calculate them from real data, and what happens when a sigmoidal curve breaks the whole hyperbolic model. Two landmark papers built this entire field. Michaelis and Menten published their steady-state model in 1913. 2 decades later, in 1934, Hans Lineweaver and Dean Burke published a linear transformation that made Km and Vmax vastly easier to determine from real experimental data. Eyeballing Vmax off a hyperbolic curve is genuinely hard. The curve just keeps creeping upward and never quite gets there. The Lineweaver-Burk plot fixes this by graphing 1 over velocity against 1 over substrate concentration, turning the hyperbola into a straight line. Memorize this transformation cold, because every inhibition question is read directly off it. Not every enzyme obeys simple Michaelis-Menten kinetics. Enzymes built from multiple subunits can show cooperative binding. Substrate binding at one site changes the affinity of the others, producing a curve that's hyperbolic no longer. Allosteric enzymes trade the smooth hyperbola for an S-shaped, sigmoidal curve. That shape reflects positive cooperativity. Binding of the first substrate molecule makes it easier for the next one to bind, producing a steep, switch-like response around the physiologic operating range. The Hill coefficient, N, quantifies this. N equals 1 means no cooperativity, classic hyperbolic behavior. N greater than 1 means positive cooperativity, the textbook signature of an allosteric enzyme. Phosphofructokinase, 1, the committed step of glycolysis, is the poster child. It's allosterically activated by AMP and fructose. 2, 6, bisphosphate when energy is low, and inhibited by ADP and citrate when energy and biosynthetic precursors are already abundant. 3 allosteric enzymes come up again and again on exams. PFK, 1 in glycolysis, aspartate transcarbamylase in pyrimidine synthesis, the classic T-state and our state model organism, and HMG-CoA reductase, feedback inhibited by cholesterol itself in sterol synthesis. Hyperbolic versus sigmoidal, cooperative versus independent. Now let's turn to the topic examiners love most. What happens when you add an inhibitor? Fair warning. Enzyme inhibition is arguably the single most heavily tested biochemistry topic on medical board exams. For patterns, for distinct Lineweaver-Burk signatures, know these cold. Competitive inhibitors resemble the substrate and bind the active site directly, so enough extra substrate can outcompete them. Non-competitive inhibitors bind a separate allosteric site on either free enzyme or ES complex. Uncompetitive inhibitors bind only the ES complex, never free enzyme. Quick pause. If this breakdown is helping you, take a second to hit like and subscribe. It genuinely takes a lot of effort to make videos like this, and your support keeps them coming. Statins are the textbook competitive inhibitor. Their structure mimics HMG-CoA closely enough to occupy the active site of HMG-CoA reductase, the rate-limiting enzyme of cholesterol synthesis, directly competing with the natural substrate. Read this straight off the kinetics. Competitive inhibition raises the apparent Km. The enzyme looks like it has lower affinity, while Vmax stays exactly the same, because with enough substrate you can always outcompete the inhibitor. Irreversible inhibitors form a covalent bond and don't let go. Aspirin irreversibly acetylates a serine residue on both COX-1 and COX-2. Organophosphate pesticides and nerve agents irreversibly phosphorylate the active site serine of acetylcholinesterase. And if that phosphate group ages, the bond becomes permanent. Exam pearl with real clinical teeth. Organophosphate poisoning is treated with pralidoxime, which can reactivate acetylcholinesterase if given before the phosphate bond ages, plus atropine to control the muscarinic symptoms: salivation, lacrimation, urination, defecation. 2 down, 2 to go. Non-competitive and uncompetitive are next, and they're where most students start mixing things up. Non-competitive inhibition drops Vmax, because a fraction of enzyme molecules are permanently disabled no matter how much substrate you add, but Km stays unchanged, since the inhibitor doesn't touch the active site's affinity for substrate at all. Methotrexate is a competitive inhibitor of dihydrofolate reductase, blocking regeneration of tetrahydrofolate and starving rapidly dividing cells of the 1-carbon units they need for DNA synthesis. The same enzyme trimethoprim targets in bacteria, just with far greater selectivity. Here's your master summary table, the single most important slide in this entire video. Competitive, Km up, Vmax unchanged, overcome by substrate. Non-competitive, Km unchanged, Vmax down, not overcome by substrate. Uncompetitive, both Km and Vmax fall together, in parallel, and the inhibitor only binds the ES complex. Visualized across 4 axes: effect on Km, effect on Vmax, reversibility, and whether excess substrate rescues activity. Competitive and non-competitive inhibition sit at almost opposite corners of this picture. Your exam day mnemonic: competitive, Km moves, Vmax stays. Non-Vmax, Km stays, Vmax nosedives. Say it out loud a few times before your next exam, and you will not miss this question. Feedback inhibition is the cell's simplest regulatory trick. The end product of a pathway loops back and allosterically inhibits an early enzyme in its own synthesis, often the first committed, rate-limiting step, shutting production down exactly when enough product has accumulated. Covalent modification is the second major regulatory lever. A protein kinase transfers a phosphate group from ADP onto a serine, threonine, or tyrosine residue, often flipping enzyme activity on or off. A protein phosphatase reverses it by hydrolyzing that same phosphate group back off. Exam classic. In glycogen metabolism, phosphorylation activates glycogen phosphorylase, which breaks glycogen down, but that same phosphorylation inactivates glycogen synthase, which builds glycogen up. One signal, opposite effects. Perfectly coordinated regulation. Phosphorylation isn't the only covalent modification worth knowing. Acetylation, methylation, ubiquitination, and glycosylation can all switch protein and enzyme function on or off, though phosphorylation remains the fastest and most reversible of the group. The third regulatory lever is irreversible proteolytic activation. Pancreatic zymogens are the classic example. Trypsinogen is cleaved by enteropeptidase in the DO-OD number to form active trypsin, which then activates chymotrypsinogen, proelastase, and procarboxypeptidase in a self-amplifying cascade. Isoenzymes, structurally distinct forms of the same enzymatic activity, let clinicians localize tissue damage. CKMB is enriched in cardiac muscle. LDH1 predominates in heart and red cells, while LDH5 predominates in liver and skeletal muscle. A flipped LDH1 to LDH2 ratio was a classic, if now largely historical, marker of myocardial infarction. Creatine kinase exists as 3 dimeric isoenzymes, CKMM in skeletal muscle, CKMB in cardiac muscle, and CKBB in brain, while lactate dehydrogenase exists as 5 tetrameric isoenzymes, LDH1 through LDH5, distributed differently across heart, red cells, liver, and skeletal muscle. A 58-year-old man arrives with crushing substernal chest pain radiating to the left arm, diaphoresis, and nausea. His vitals show tachycardia and mild hypertension, classic for an evolving myocardial infarction, and exactly the scenario where isoenzyme and biomarker kinetics become clinically decisive. Know this timeline cold. Troponin rises within 3 to 4 hours, peaks at 24 to 48 hours, and stays elevated for 7 to 10 days. CKMB rises slightly later, peaks around 24 hours, and normalizes within 48 to 72 hours, which is exactly why it's still useful for detecting a RI infarction that troponin's long tail would otherwise mask. Regulation is how the cell controls enzymes in real time. Now let's see what happens clinically when the enzymes themselves are broken from birth. A 2-week-old infant, born of a normal pregnancy, is brought in because the newborn screen flagged an abnormality. On exam, the parents mention a faint musty odor to the baby's urine and skin. Untreated, this enzyme defect leads to severe, irreversible intellectual disability. Phenylalanine hydroxylase normally converts phenylalanine to tyrosine, using tetrahydrobiopterin as a cofactor. When PAH is deficient, phenylalanine backs up and gets shunted into phenylketones, phenylacetate, phenylactate, and phenylpyruvate, which are neurotoxic and give the urine its characteristic musty odor. On newborn exam, don't rely on odor alone. It's often absent early on. The real diagnostic trigger is the universal metabolic screen, a heel stick blood spot collected at 24 to 48 hours of life, now analyzed by tandem mass spectrometry rather than the older bacterial inhibition Guthrie test. Modern tandem mass spectrometry newborn screening for PKU offers excellent sensitivity, making false negatives rare, which matters enormously, because irreversible neurologic damage begins accumulating in the first weeks of untreated life, long before symptoms would otherwise appear. The workflow is simple and universal. Heel stick screen at 24 to 48 hours. Immediate confirmatory testing if flagged, then urgent dietary phenylalanine restriction with tyrosine supplementation, ideally started within the first 10 days of life to protect neurodevelopment. Left untreated, PKU causes severe intellectual disability, seizures, hypopigmentation from decreased melanin synthesis, and that musty odor. Caught by screening and managed with strict dietary Phe restriction, affected children can achieve essentially normal cognitive development. This is one of medicine's clearest public health success stories. Since universal newborn screening for PKU became standard practice, population-level rates of PKU-related intellectual disability have fallen dramatically. A textbook example of a screening program with genuinely transformative outcomes. Second vignette. A 6-year-old boy of Mediterranean descent develops dark urine, jaundice, and fatigue 2 days after eating fava beans at a family meal. His hemoglobin has dropped acutely. What enzyme deficiency belongs at the top of your differential? G6PD, glucose, 6-phosphate dehydrogenase, is the rate-limiting enzyme of the pentose phosphate pathway and the cell's main source of NADPH. Without it, red cells can't regenerate reduced glutathione, leaving them defenseless against oxidative stress. And oxidative damage to hemoglobin and the red cell membrane triggers hemolysis. On peripheral smear, look for Heinz bodies, denatured, precipitated hemoglobin visible with special stains, and bite cells, formed when splenic macrophages pluck those Heinz bodies out of otherwise intact red cells as they pass through. The hemolysis panel tells the same story from the lab side. Elevated LDH from cell lysis, low haptoglobin as it mops up free hemoglobin, elevated indirect bilirubin from heme breakdown, and an elevated respiratory count as the marrow compensates. We're in the final stretch. Let's lock in everything you've just learned with a rapid-fire recap built for exam day. Myth: all 4 inhibition types look basically the same on a graph, so it doesn't matter which one you pick on the exam. Fact: each produces an unmistakable, distinct signature on a Lineweaver-Burk plot. Slope, x-intercept, and y-intercept all move in characteristic, predictable ways. One more time, side by side. Competitive inhibition: Km climbs, Vmax holds steady. Non-competitive inhibition: Km holds steady, Vmax falls. If you remember nothing else from this video, remember this contrast. Rapid recap. What does a low Km tell you about an enzyme? High substrate affinity. What happens to Vmax with a non-competitive inhibitor? It decreases and cannot be rescued by more substrate. What enzyme is deficient in PKU? Phenylalanine hydroxylase. And what's the main clinical trigger for hemolysis in G6PD deficiency? Oxidative stressors like fava beans, certain antimalarials, and infection. One exam-style question before we close. A new inhibitor is added to an enzyme assay. The Lineweaver-Burk plot shows an unchanged x-intercept, but a higher y-intercept. What type of inhibitor is this? Your final exam prep checklist. Know the Michaelis-Menten equation and what Km and Vmax each represent. Know all 4 inhibition patterns and their Lineweaver-Burk signatures. And know the PKU and G6PD deficiency mechanisms cold. They show up constantly. Final high-yield numbers to lock in. Km equals substrate concentration at half Vmax. Troponin rises in 3 to 4 hours post-MI. Catalase turns over roughly 40 million substrate molecules per second. And PKU affects roughly 1 in 10 to 15,000 newborns. Enzyme kinetics isn't just abstract math. It's the language your exam, and eventually your patients, will speak in Km, Vmax, and everything in between. Here are the key references and sources for this video. Thanks so much for watching. If this helped, like the video and subscribe for more clear, simple explainers, and I'll see you in the next one.